Hello, I'm Dr. Schroeder, and I'm going to go over how to take your horse's vital signs. That includes the horse's temperature, its pulse or heart rate, and its respirations. First thing we'll go over how to do is how to take the horse's pulse. And two places you can get the pulse. The first we usually try to get it at is the artery right here that runs underneath the mandible. If you take your fingers and run them on the inside of the mandible here, and kind of scrub them back and forth, you should feel something, the consistency and size of, kind of feels like an earthworm, and that's their artery right there. And if you gently put your two fingers over that artery and count the pulsations for 10 seconds and multiply it by 6, their normal pulse or heart rate is 30 to 20 beats per minute, so it's going to be slower than ours. And so you're going to have to really feel for that pulsation. 1, 2, 3, 4, 5, 6. So that's 6 beats within 10 seconds. I multiply that by 6, so that's 36. Her heart rate is 36 beats per minute. The other place you can get their pulse is down here on the pastern, on the back of the pastern or the back of the fetlock. The places you can feel and kind of strum your fingers and feel an artery back there, and you can count again pulsations of that artery for 10 seconds and then multiply by 6 to get their pulse there. The third place is to feel their heart rate, and if you don't have a stethoscope, you can try to get your hand, slide your hand in between their left elbow, deep in there in their chest, and feel for the love-dove beat of their heart. And each love-dove beat is each love-dove feel is 1 beat to their heart, and you count again for 10 seconds and multiply by 6. Or if you have a stethoscope, you can hear that love-dove beat in there. You slide the stethoscope in between the left elbow and the chest until the head of the stethoscope disappears behind their elbow. Right underneath that elbow is where their heart is the best heard. Love-dove, 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 love-dove. And again, each love-dove is 1 beat. You count for 10 seconds, multiply by 6. Should be between 30 and 40. If the horse is really nervous, sometimes their heart rate will be elevated when you first start to listen to it, but then if you keep your stethoscope or your hand in there, it should slow down once they get used to you touching them there. The next thing to do is to count the respirations. You're going to look at their abdomen and count how many times their abdomen comes out for a breath and then in again. So there's 1 breath out and back in. And this can be tricky depending on how much the horse is moving. Again, that's an in breath, here's out and in. And you may have to watch this for a full minute to get a count on it, depending on how easy it is. It's usually easier if the horse is in the stall by itself and you're standing on the outside of the stall watching him, to watch that abdomen rise and fall and count their respirations. And again, I count them for 10 seconds. And the respiratory rate should be between 12 and 16 breaths a minute usually on a horse, unless they've recently been running around. But if they're calm and in a stall, it should be about 12 to 16 breaths a minute. The next thing we do is take their temperature, and I usually pet the horse, touch the horse, make sure that they know that you're coming toward their rear end. Stand nice and close to the horse, so if they try to kick you, the closer you are, the less impact there is. So you want to come back here and just make sure the horse knows you're coming back there. Make sure they're not switching their tail or picking their leg up like they're trying to kick you. And as long as they're not, continue and grab the tail. And on mares, you're going to have the rectum on the top and then the vulva down here. And on geldings and stallions, you're just going to have the rectum. And you'll get a regular digital thermometer at a CVS or Walgreens or just the grocery store. And it doesn't have to be a rectal thermometer, just any digital thermometer. And you just insert it about 1 inch or 2 in the rectum, and then hold it in there until it beeps at you. Or if you have a glass thermometer, for about 1 minute. And then when it's done, you read their temperature. Their temperature should be between 99 degrees and 101. On a hot day, or if they've been running, it might be 101.5. But anything above that, especially if your horse is not acting right, then you should probably call your veterinarian. So her temperature is 99. So that's normal.